I want to ask in a very simple way. What is actually biodynamic body psychotherapy?
You know something? It's the simplest and it's the hardest question to answer.
I can imagine.
Because it is a combination of psychology, psychotherapy, and physiotherapy, dynamic physiotherapy. So we do touch treatment. It is like a massage, but we don't call it because we have the stethoscope that are guiding us so that we can hear the stress formation.
I see. So the stethoscope is like a microphone on your belly, and there is a speaker,
Yes.
and you hear inside of your belly.
You
To
hear,
put it technically.
you hear all the different sounds, which tells us where we can touch or how long and what kind of touch.
So the sound is your diagnostic system.
Yeah, exactly.
I see.
And so it's also the antenna that we can feel. How do we have to touch? Do we have to do a light touch, a dynamic? Do we need to ask the person to breathe? Is it too watery? Is it too tight? Okay, because the intestines, it's a muscle. It's a smooth muscle holding the whole intestines, and nobody thought about it. We can listen to the contraction and the expansion, which has to do with your feeling. When you're uptight,
So the happiness.
I would say you have a constipated mind, and maybe
Constipated mind. So the happiness is in the belly.
yes, I like the Chinese, well, the East have been saying. It is how do you trigger that the subconscious are ready to work on its self-regulation, to regulate your whole nervous system, your hyper and hypotension in your whole body. So we are holistic all the time. We have cellular memory, and when that contracts, it makes illness, and when it has a good flow, then it's healthy. When you breathe, when you pulsate, like spasm, you're like then you live. We live by contraction, expansion, like the cell.
Pulsation goes through all the therapies, more or less.
There's a lot of repressed dynamic in people that is not conscious. So they are suffering from somatic or emotional phobias or problematics in which they think helps with either sports or medicine or reacting out.
Well, one interesting thing I heard is about conscious, unconscious. So if we talk about psychotherapy as I know it, talking.
Yes.
People are conscious about their problems.
People are conscious about it.
Is it different with body psychotherapy? If you say it's unconscious, then and it maybe closes the gap.
Well, the thing is that if you close your eyes, you can start to talk what the consciousness feels like. That means you're not cognitive about it. It's not talking about it. It is how your body feels when you access the conscious material, when you symbolize this, when you dream, when you start to ask, how do you feel within your body? How do you feel when you talk about that? People say, okay, talk about your feelings. Yes, well, I'm feeling tired, but if you say, let yourself breathe. Breathe into and feel what your body wants to say. It's a whole different level. So you can say that bioenergetic goes from the periphery to the center. And we go into the dynamic of the breathing, of the pre-conscious.
I see. Interesting. So That means this pre-conscious, this unconscious thing can emerge from your
Yes,
body
yes.
and reveal some problems that you wouldn't be able to reveal in a
Yes.
classical psychotherapy.
Then you would say that was unconscious.
That was
So I call it subconscious, pre-conscious, conscious. So that means when you have a dream, you've forgotten it. And the thing is that there is not one way. Each of you, of the people, will do what they are meant to do. Some might be stronger in certain massage types or in certain approaches. So it's very individualistic, but the framework and the essence is the same. Very important to say that it is not taken away from classical family therapy methods or from analysis and talking therapy and cognitive. It's all a part.
So it's not really a competitive method.
No,
it's
a complementary, very complementary.
All right,
Yeah.
all right, complementary.
Integrative, and we use quite a lot from family therapy and from bioenergetic, and we of course know many are from the Orgonomy and the core.
I see.
Okay.
Integrative sounds
Integrative.
really great.
Like the name of your center.
Exactly.
Okay, bye. Okay.